How long have you been a dentist?
I became a dentist in 1995, so I've been practicing for about 27 years.
Wow.
Long time.
Yeah.
Wow. That is a long, long time.
Yeah.
And along the way, I realized that just being a drill and fill dentist wasn't interesting for me. I want to really take care of people. I want to really handle for them, getting them a fully healthy mouth, right? A great smile that can create for them confidence so that they can go out and do more, right? I wanted to make sure that the health of their mouth, right, allowed their bodies to be healthy, and because everything's connected.
Right.
Our bodies are connected, right? So I wanted to make sure I was really helping people, right? And so I started on a journey of education, advanced education, to learn all the aspects of dentistry so that I didn't have to send people everywhere, like in a medical office, like you go to see to a million different people, and it's so stressful. And I learned very early on that when you send somebody out to do something else, that they're probably not coming back to you, right? Because they get lost. And I didn't want people to get lost because my goal is to make healthy mouths, healthy teeth and gums for life. That's the goal, right? And I want beautiful smiles, and I want people to be healthy and be smiling all the time. So I did that educational journey, as I said, to develop a practice where it's like a one-stop shop. I take care of everything that people need, right? So that whatever they come to me for, I can generally care for them. Very few things get sent out of my office. I do refer some things, but not a lot. Wow. So I'm able to really take care of people and develop that kind of rapport where they can feel confident and comfortable that they can do it all in one place.
Wow, that's amazing. So you're the one-stop shop.
One-stop shop.
Basically.
Sure.
So you said you had some special training afterwards. Obviously, you have 4 more years of dentist school, but did you do any other types of special education in terms of studying for different things in order to be able to service all different types of dentistry?
Yeah, so there's all kinds of advanced training out there, right? So that you can get the training that you need to be able to provide all the services. And so one step at a time, I looked into the training for making people have beautiful smiles, right? Already knew how to make their mouths healthy, right? That was one thing, but giving them a beautiful smile, that was something else. So a lot of advanced training in cosmetics, I did that. I did also training in TMJ treatment, because TMJ, those are your joints in your mouth, and a lot of people think it's just the joints. But when the joints are malfunctioning, it causes pain, causes headaches, causes ringing in the ears, even can cause tingling in the fingers, all because your jaw's out of joint because it throws your neck out of joint.
Wow.
So being able to treat that by putting the teeth in the right place and balancing the bite, right, really helps people because it gets rid of their headaches and it gets rid of those neck pains that they were getting all from their jaw being out of whack because their teeth are out of whack. So when the teeth are out of whack, it throws the jaw out of whack, throws the neck out of whack, and people really suffer.
Right.
So I did that training as well. And then I realized I needed to take even better care of getting people's gums healthy, right? So I got advanced training in laser gum surgery, so that's really valuable because laser gum surgery is no cut, no sew, right? So you're not cutting the gums and getting rid of the gums, you're saving and preserving the gums and helping people keep their teeth for life, which is really, really important to keep your teeth because people who have their teeth live longer than people who don't. Right? And so, then I moved on to gum grafting because it's all part of the gums, right? Then realizing that getting the teeth aligned to get the jaws aligned required that I knew how to straighten the teeth. So did some ortho training, and we do ortho to align the bite. We also do Invisalign to align the bite to get people that ability to have their bite balanced so they're not causing all those other problems.
Wow.
Right? So just on and on and on. The training never ends.
How many years was that?
Oh, just ongoing for all of the years.
Even to this day, you're still learning and learning new things.
Yeah, so it was 1995 when I started, 1999 when I bought my own practice. By 2003, I had decided that it was time to move on more advanced training, and since 2003, I've been doing that. And then 2008, I started doing implant dentistry as well, because people were missing their teeth. They need to have their teeth. Implant dentistry, implant dentures. There's all this people do the new teeth now and the teeth in a day and all of these other things. It's just simply rehabilitating the bite with implants. So we do that as well. You know, giving people their function and bite back by using implants.
Wow. So I know you've touched on already some of the services that you do. Could you expand on some of them a little bit more? Because like if let's say I want veneers, can I come to you for that?
Absolutely. So veneers is cosmetic dentistry.
Okay.
Right? And my advanced training covers giving you a beautiful smile, right? And many times people just are not happy with their smile. And one of the things that's going to benefit them is a set of veneers, which are porcelain coverings over the teeth, right? To give them that perfect smile. It's fast too, because it's an instant change. We make temporaries that are going to go over your teeth, right? We prepare the teeth, and then when we give you the temporaries, they are as beautiful as the final result's going to be, so that you're so happy, right, with the temporaries. And it was instant. You came in with your teeth, you left with new teeth, and then a few weeks later we give you the final veneers, and just beautiful.
Wow. So it's that fast now.
It's fast.
Just like instant. Like I've heard also there's like same day crowns and things like that. It's so interesting how like 10 years ago it was completely different than it is now.
Yeah, dentistry is changing all the time.
Right.
And you got to keep taking advanced training in order to keep up.
Right.
Because gosh, you blink and now it's changed. Hi, my name is Dr. Brian Whitt, and I'm the owner of Terra Smiles Dentistry. Welcome to our practice. Thanks for choosing us. So, many people wear dentures in this country, and unfortunately, most people leave them in a drawer. Are you one of those people? You can't chew with them, you'd rather just not use them. They move around, they don't stay in place. We have a solution for you. One of the great solutions on having dentures and getting your smile back is to be able to do implant dentures. Implants are a wonderful opportunity for people, because when we place an implant, we can secure your dentures and you can eat anything you want. Wouldn't you like to go to the restaurant and not have to worry about what your dentures can chew? You go to the restaurant, you order what you want, and you eat with confidence and not worry about it. Smile with confidence, eat with confidence. That's what an implant denture can do for you.
Hi, my name is Sandy, and I first started coming to Dr. Witt in 2010. I had, my situation to me was extremely devastating to me personally, because I had always had wonderful teeth, had always taken very, very excellent care of my teeth, and was always told that my teeth would last me my whole life if I continued to take such good care of them. But then I developed some kind of infection in my teeth that no dentist, no specialist. I went to the University of Florida to be tested. They couldn't figure out what was wrong. At USF Medical Center, they couldn't. I went to specialist after specialist. They go, I don't know, can't figure out what happened. And because it was so devastating to me to hear that I was going to lose my teeth, it really kind of knocked me for a loop. And it turns out I had to get all of my teeth extracted because they were falling out anyway. I mean, seriously, they just started crumpling and falling out. And I was not happy with the dentist that had extracted my teeth and built my first set of dentures. And I said, I've got to find somebody that can make a product for me that makes me happy. This is life affecting. It's in your job, in your personal life. I couldn't smile, I couldn't eat, it was difficult to talk. Very devastating, and I use that word a lot. And so I finally said, I've got to find me somebody, some dentist that knows what I want and knows what I need. I found Dr. Witt online. I just hunted this a doctor in the Temple Terrace area, and there was Dr. Witt, and I read all of his information on site and made an appointment. From the minute I walked into this office, I have been treated like royalty. since the minute I first walked in here. The staff is so professional. They're so helpful and kind. I mean, it was never a bad experience coming here. Immediately, Dr. Whitt knew what I wanted. He knew also what I needed, which is extremely important because some things I just didn't know that I would need them until without his expertise. Immediately he said, "Oh no, those dentures you've got now, they're nope, we got to fix those." That day, he took all my measurements and made me a new set of temporary dentures. And then what I wanted, and he concurred, I wanted dental implants for my teeth. I had never even thought about having dentures, but the little bit of experience that I'd had with them so far, it was just something I could not live with. I couldn't live with the dentures. There was no eating, no smiling, no talking. It affected me in my life to the extent that I didn't even want to go outside my home. Didn't want to go to dinner with friends because I couldn't eat. So anyway, he made me new dentures that day, and they fit so beautifully and look so good. And just that one step improved my quality of life so much. We immediately, we did choose to go with the dental implants, and that's where there are posts drilled into your lower gum and your upper gum, and then Castromate and all sorts of other actions are taken. So when you get the denture, they snap in. So there's never a danger of them slipping or falling out. For those of you that are lucky enough to not be aware, dentures really, really hurt. If they're loose or they're moving, it's so painful. And once you get like a little sore spot on your gum, it's days and days before that heals up. And you just don't even want to wear your dentures. So we started the process, had all the, it is surgery to have the post implanted into the bone in your jaw. And all that was done right here in Dr. Whitt's office, incredibly patient and kind. And what I love too about him is he is probably a bigger perfectionist than I am, and that's saying a lot. And it's a process that takes about 18 months when you're newly toothless. when your teeth have been extracted, if you have been without teeth for a long time, then it does not take that long period of time. So I had to keep going through phases where as my your gums shrink without the teeth in them, when I finally got to see the finished product, it just was so life-changing. The dentures snap in, bottom and top, and you never have to worry about them. They are removable. I can remove them to brush them and keep, of course, because you still want to have good hygiene in your mouth. So you scrub them. You also have all the products which you may know about where you can soak them overnight. And even still to this day, I still come and get my teeth cleaned, and the gums and the posts have to be, you have to take care of those also, just like teeth, because tartar does build up around them. But it's just the beauty of going out and knowing that my teeth look good. I have been going through the grocery store line, and the cashier, "Whoa, look at that beautiful smile." Honestly, I'd always gotten a lot of compliments on my teeth, and that's probably why my circumstance affected me so. But now, thanks to Dr. Whitt, I still get compliments on my teeth. Something else that really is wonderful, there's a lot of wonderful things about the dental implants, and the advantages are you do not have to use polygrip. You use no adhesive, because it's from a perfectly practical standpoint, that is messy stuff. I mean, it is awful. It tastes terrible. It gets all over everything. It stops up your bathroom sink. It's awful. So I don't have to use that at all. I can eat anything. I mean, anything. Corn on the cob. I couldn't wait to have a big old juicy steak. You can eat raw carrots. It's just like your real teeth. It's just remarkable. I'm so happy. I cannot say enough good things about Dr. Whitt, his entire staff, just for their professionalism and the way they treat you like royalty. And it's a commitment to have the dental implants, not only a time commitment to go through the steps, but also a financial commitment. So I needed a team that would feel the same sense of urgency and the same sense of importance to my problem as I had. And I found that here with Dr. Whitt and his staff. It's a beautiful thing. It seriously is a beautiful thing. And I tell everybody, oh, I've got this dentist, he's wonderful. I stop him on the street, go see Dr. Whitt. He absolutely is amazing, and if this catastrophe ever should fall on you, I would hate that for you, but come see Dr. Whitt.
I love cosmetic dentistry because cosmetic dentistry transforms your life and your confidence instantly. It is the biggest bang for your buck, cosmetic dentistry. And cosmetic dentistry also includes full mouth reconstruction, right? Implant dentistry, giving you that new smile fast is so important because it builds your confidence and it keeps your mouth healthy. Because you're not going to have cosmetic dentistry until your mouth is already healthy.
Right.
Health is always first, right? That's the most important thing. It's the foundation. We make sure the teeth and gums are healthy. Then we create a beautiful smile for you so that you have the confidence to go out in the world and smile. Because a smile is worth so much to your life and to your happiness and your well-being. That's next, right? And some things like we do ortho in the practice and we do Invisalign in the practice, but that takes a while to get you to that perfect smile. But if your teeth are already beautiful, right, they're gorgeous, they're just in the wrong place, then we're not going to do anything but ortho and you're just going to have to wait a little while. Cosmetic dentistry is for you, your teeth are ugly, right? And you need to have beautiful teeth so you can have the confidence that you need to get that better job, to get that promotion, to do better, to smile more, to be happier around your kids, right? So we give you that change, and it's a fast change.
Is your favorite like when they walk out of the office and they look at you and they say like, I can't believe my smile can look like this, like thank you. Like how do you feel when your patients come to you and tell you that? Does it just like make everything worthwhile?
Oh my gosh, the biggest thrill in what I do is when the person validates that they're so much better because of what I did for them. Their life is better. Everything is better. They feel better. Their blood pressure is down. They got a new job, right? Whatever it is, and they're smiling more. Yes, no, that's the validation of what I do every day. When somebody is smiling more and they're healthier and they know it and they tell me about it, oh my gosh, it's the biggest thank you. Hi, my name is Dr. Brian Whitt, and I'm the owner of Terra Smiles Dentistry. Thank you for choosing our office. One of the advanced services that I provide here is helping people get a beautiful smile. One of the ways that we do that is with a smile makeover. Smile makeovers, depending on what you need, can be done in several different ways. But when it's finished, wow, you look great, you want to smile, and you have the confidence to go out in the world and do what you need. That is what a smile makeover can do for you. It brings what you are today to what you can be and experience a fully beautiful smile. Do you feel that when you take a family picture, you're hiding your smile? Some people do. Do you feel like you can't smile in public because you're afraid of what others might think? These are very big issues for some people, and they feel like they can't smile because they don't like the way their teeth look. Here at Terra Smiles, I pride myself on being able to help people get a beautiful, perfect smile. So ask us if you have any questions about making your smile better. I can really help you with that.
Hey, my name is Courtney. I've been seeing Dr. Whitt for about 4 years now. I came to him and I had crummy teeth. I think one of the first things I said to him was I wanted my smile back, and that's what he did for me. He and his staff are really great. They've been nothing but the best all the time. There was a point where I was like afraid to smile or open my mouth, or I'd always cover like this and you know. But now, after months of gum surgery and teeth rebuilding and a lot of time and effort they put into it, they helped me a lot and gave me my smile back, and that's what I wanted. They've been nothing but professional, kind and courteous, and they always go the extra mile for you. If I could do it all over again, I'd do it the same way. I wouldn't change a thing. I had to have gum graft, so there was like space between my teeth and my gums there was a gap. So I had to have that grafted surgery, which is painful and like weeks of stitches in your mouth. I just had like bad genes in my teeth, so just a really crummy, decay and rot, and it was, now I don't. But when you saw what was going on, you were like, okay, it's gonna get better, it's gonna get better, or you'd see things, you're like, God, it's terrible, but he made it right for you. I mean, he does good, does great work. Like I said, he's always professional, watches out for you. I mean, he's never one, if you're in pain, he takes care of that. He's always, treats you like you want to be treated from a dental point of view, which is a really great thing. Knew what you wanted and did it for you, you know what I mean? Yeah, it's an expense and everything, but you realize that if you want to have your smile back, he's going to help you do it. He made it work for me.
So now, Dr. Witt, I do want to talk on, you mentioned whole body health. How important is your mouth in terms of like your entire body?
Well, everything is connected, right? Your mouth is connected to the rest of your body, right? And when you have infection in your mouth, it has a direct link to the bloodstream. And it's getting that infection and that bacteria and those toxic chemicals that are put out by that bacteria flowing through your whole body. It gets in your brain, it gets in your heart, it gets in your lungs, it clogs your arteries. It leads down the road, right, to major health concerns. So I tell people that, if you come to me and you're not well, right, you have high blood pressure, you smoke, right? You're not skinny, right? You are overweight, like most of us in the world, right? You're overweight. You have those three things going on, maybe even though, and you also have diabetes, which is a huge addition to that in the dangers of your health, right? And I look in your mouth and you have gum disease. It's not a matter of if you're going to have a heart attack or stroke. It's a matter of when will you have that heart attack or stroke, and will you make it? If you put those health conditions on top of having infection in your mouth, you are going to have a major event.
Wow.
A major event, and you might or might not survive it.
Right.
And my job is to help you get that mouth healthy, because that's my part, it's my role in the whole body health. The healthy mouth is going to take the pressure off those other systems so that you can get those other systems handled. Now you have to handle those things on your own. You have to stop smoking. You have to change your diet. You have to, lose weight, right? And you have to control your diabetes. But if you're doing that without having infection in your mouth, you're going to be 10 times better. There was a study done, it was very interesting. There's a certain marker in your bloodstream that shows the risk of heart attack, right? And when there is infection in the mouth, that marker is off the chart. And they can take, it was in Atlanta, a company in Atlanta, when they can send them to their dentist and have that tooth handled or the gums handled and there's no more infection, that marker drops to a very low rate and your risk of heart attack and stroke diminishes greatly.
Wow. Like that quick.
Just like that. Just like handling that, and that marker for heart attack goes down and your risk of it is much less.
Wow.
Right? We also know that having that chronic infection in your mouth is what clogs your arteries. So lots and lots and lots and lots and lots for so many years we were like, cholesterol is what clogs your arteries. No, it's the chronic infections in your mouth that create the clogs in your arteries. So you end the chronic infection in your mouth, you handle the health of your mouth, and you're less likely to have those things in such bad conditions.
Is it true that there's like a study or some crazy statistic that's like 7 out of 10 people have gum disease?
Yes.
And that's like linked to, heart disease and all these types of things that you're talking about now. I think that's kind of like eye-opening.
That's right. That's right. 7 out of 10 people have some level of gum disease.
Yeah.
Right? It can be an early level or it can be a very late level, but handling it's really important. And just brushing your teeth properly, brushing your gums is really important. Most people, and it's crazy the amount of people, most people come to me and they're under the impression that you brush your teeth, right?
Right.
And they don't brush their gums because their gums bleed when they brush them. And people are under the impression, because they think the gums are like your skin or something, that when you brush your gums, if they bleed, you should avoid them so that they have time to heal. It's backwards thinking, because if you had a cut on your hand, right, and it's scabbed, and you brushed it hard, and the scab came off and it bled, you'd say, oh, let me let that scab heal. But let's say you have a gash that needs stitches, it's bleeding, you go to the hospital, the first thing they're going to do is scrub the wound clean. That way the wound can heal, right?
Right.
The reason your gums bleed is because the wound is filthy. The gums are disgustingly dirty and are full of bacteria that's causing an infection. And the sign of that infection is blood. So if you see blood or have pain when you brush your gums, it means brush them harder. You've got to do what the hospital would do and scrub that wound clean.
Wow.
You got to scrub them, they're going to bleed, it's going to hurt, you might even cry. Brush them harder. Because we know that a soft toothbrush, the bristles of a soft toothbrush will never ever hurt your gums or your teeth. They can't damage them in any way. But bleeding gums is the sign that you've got gum disease. It's not the sign that you have to avoid them. But most people think that when they see bleeding or if their gums hurt, not to touch them. It's backwards thinking, and the most important thing is that you get in there and you scrub it hard. And you scrub it every day, twice a day. And at the end of a couple of weeks, the gums won't hurt anymore and they won't bleed anymore. All right? But you need to get to a dentist right away and make sure that you don't have a worse gum infection that needs to be treated at the dentist.
Right. So obviously signs of gum disease are if your gums are bleeding. Are there any other signs or symptoms to let me know, like, oh, hey, this isn't totally right and I need to call you and go see you?
Yep. If your gums bleed or hurt when you brush them or floss them, that's the sign, right? If you had bad breath, that could be the sign too. Bad breath comes from lots of different places, but can be coming from your gums or your tooth infections, right? But bleeding and pain when you brush or floss your teeth is the sign that you need to see the dentist right away.
All right, well, I'll call you.
Oh, that's awesome.
Hopefully I don't have to, but
hopefully you don't have to.
Call you.
Well, you got a beautiful smile. I don't think you're going to have to.
Thank you.
know, absolutely. If you have an emergency, call us. If we can get you in, we want to help you, right? Our job, my absolute end result of what I do is to give you whole mouth health and beauty. It's the whole picture. It's not just putting out that fire. And what I tell people, and I say this a lot, you know, it's like having fire in the forest. So all the trees are on fire, right? But you're coming in for that oak tree that's in the middle. It's your favorite oak tree. It's been in your family for hundreds of years. And you want all the water on that tree, right? And you're not gonna do anything about the rest of the fire. So when you leave, right, the fire department leaves, they put the water on, what's gonna happen to that tree? That tree's gonna catch fire again, and you're gonna lose the whole forest. So I want to put the fire out in the whole forest, right? And then fix the trees. That's what I want. Because that way, you're gonna have whole mouth health and whole body health associated with what your mouth can do for your body. Not just put the fire out. I'm not a dentist that puts fires out. I will put your fire out because it's vital that you don't have pain, but I want you to move towards putting that whole forest fire out, right? And getting that beautiful, healthy, balanced smile. Hi, my name is Dr. Brian Whitt, and I'm the owner of Terra Smiles Dentistry. One of the advanced services that I'd like to share with you that I provide for our guests here is the treatment of TMJ problems and headaches. Not everybody knows what a TMJ is. The TMJs are the jaw joints. And sometimes when people have problems with their jaw joints, they get headaches. Do you experience headaches? What we know about headaches today is that headaches are mostly caused by problems with the teeth, the bite, and the jaw joints. So if you have a misalignment or an imbalance in the way that your teeth bite together, crowded teeth, deep overbites, overjets, maybe you've heard of those. These things can cause headaches, and we can eliminate those headaches for you by making sure that we get your bite aligned correctly so that we can help those muscles around your face and your jaw align correctly so that you get your headaches eliminated. We're very successful at taking care of people's headaches by aligning their bites and jaws so that you can have a life without pain.
For as long as I can remember, I've had migraines. I was treated for allergies for 5 years because they didn't know what it was. They didn't want to fix the problem. I was having migraines, my jaw was tense, there was fatigue, and I was missing work, and I was almost fired from my job. It was probably around a year and a half before I found Dr. Witt after I was seen by 6 specialists. He said that by making a mouth guard that I wore 24/7, it was hard to talk, but I managed, and he fixed the mouth guard on a monthly basis until the headaches were finally gone completely. It took about 2 months before the headaches were gone, and I've been pain-free for 6 months now, and I've got braces on about 4 months ago, and they're moving rapidly now. I still got 2 guards in the back. It was broke, and he had to miraculously put the guard on. My mouth, he had to glue it in. I've already been pain-free for 6 months, and I am looking forward to the end results. If it wasn't for Dr. Witt, I wouldn't be pain-free, and I wouldn't have a job, and I wouldn't be able to enjoy life like you're supposed to enjoy life.
People come to us from all over who have headaches and have pain in their head and neck, and when we help them eliminate that and get back to their lives, they're able to get off their medications that they're taking for pain. They're able to sleep. They're able to get along with their families better. We really help people enjoy their lives better when we take care of their headaches. So if headaches is something that you are troubled by, please let us know so that we can help you take care of it. You know, there's so many studies that show that it's straight teeth that keep the mouth healthy. Right?
Wow.
You have all your teeth and they are straight. Is extremely important. There are bacteria that only live around crooked teeth.
Really?
Only around crooked teeth that have been linked to a heart attack and stroke and other things like colon cancer.
Wow.
That when the teeth are straightened out, those bacteria no longer can live there. And the colon cancer risk is much less.
So then let's talk about that too. So you obviously do braces, and I'm assuming clear aligners or some sort of like Invisalign.
Invisalign and regular braces also.
Amazing.
Some people don't want to do Invisalign and they only want the braces. If they're a straightforward case, I do the braces for them. If they are an advanced case that they need to see an orthodontist, and sometimes we refer them to an orthodontist. If it's a TMJ case, to balance the bite, and ortho is the only, orthodontics or regular braces the only thing that solve that, then we do that too.
Okay, so like if I felt like my teeth were crooked, I could come to you and you could, what would happen? Like you would assess my teeth, or how would that process work?
Yeah, if you have a healthy mouth and your teeth are crooked and you want to handle that because of just what I said, that crooked teeth have bacteria that only live around crooked teeth that are damaging the health of your body, and you don't want that, you want to have a healthy body, then you need to have straight teeth. Straight teeth is just not about cosmetics. Straight teeth is about the whole health of your body. It's so important. Then you come in, we take a look at everything, we handle anything unhealthy first. It's very important. We get the mouth healthy first, and then we align the teeth, which is really, really important for whole body health.
Okay, so what would like the cases of like someone who needs like traditional braces versus someone who would need like some sort of clear aligner or like Invisalign, how would you like suggest one type versus another?
Well, Invisalign is an incredible product and can handle most people's crooked teeth issues. It is amazing, and it's come so far in just the last 5 or 6 years. It's advanced incredibly amount. Then it's a choice. Like if it's something that Invisalign can handle, we want to put you in Invisalign because it's so easy for you. Clear aligners are so easy. You know, brackets and wires, right? They're tough to clean. They make the gums swell up sometimes. They hurt your cheeks, right? So they're not as easy for most people, but some people only want to have those brackets and wires on their teeth. That's great. You know, if they're a straightforward case, no problem. You know, if you have real bad bite issues in the back teeth, really, really bad of the back teeth, then clear aligners probably aren't going to work for you. And you'll need to have something more.
Okay.
But we'll assess that when you come in.
Right. Okay. How long does do clear aligners typically take now?
You know, you can be in and out of Invisalign in 6 to 8 months.
Wow.
Right? If you don't have a lot to do. And some people have a lot to do. You could be in clear aligners or in regular braces for 2 to 3 years. Long time, right? And it's just your willingness to get through that to get to the final result, which is that perfect straight teeth. Having straight teeth and beautiful teeth, it's confidence.
Right. And it's so interesting to hear that like not only is it just cosmetic, like the way that it looks, but it also affects your health.
Yeah.
I never knew that.
It's really important that that gets out there and people know that crooked teeth affect your health. Hi, my name is Dr. Brian Whitt, and I am the owner of Terra Smiles Dentistry. One of the advanced services that I want to share with you today is laser gum surgery. Laser gum surgery is a service that I provide here that helps people keep a healthy mouth and healthy gums for life. Many people don't know about gum disease. Some people know it as pyorrhea. Some people know it as gum disease. Some people know it as periodontal disease. It has a lot of names. Some of the symptoms that you might notice if you have gum disease is your gums might bleed when you brush them. They might bleed when you floss them. Your gums might hurt sometimes, and they might be red and puffy. And laser gum surgery is a way that we can help you eliminate those things from your mouth and get your gums healthy. The gums are the foundation of the health of the mouth and the teeth. Without the gums, the teeth fall out. So in order to make sure that we keep your teeth for life, we need to make sure your gums are healthy.
Temple Terrace dentist Brian Whitt is doing that in a new way, using a laser. He showed me how the laser obliterates pigmented areas, in this case, the raised ink on his business card.
Without damaging the paper.
In the mouth, infected tissue and bacteria are pigmented. Healthy tissue is left untouched. The laser is aimed at diseased tissue and bacteria below the gum line. The healthy tissue left behind forms tiny peg-like projections which help the gums reattach to the tooth. Ultrasound is used to remove any tartar near the root. The gums then heal around a clean tooth surface.
For the past 15, 20 years, I've had gum problems that I have been really unable to resolve. I had a couple of periodontal so-called experts look at it in Fort Lauderdale, and they were not able to satisfactorily fix the issues. I had deep pockets. I guess there were 8 to 11 millimeter pockets in the gums. And eventually I moved actually from Fort Lauderdale to Wesley Chapel, and I have been here approximately 3 years. Well, 2 years ago, I really started to have a gum issue, which was very, very painful. So I went to a periodontal outfit in Tampa, and they determined that I had some bone loss in the jaw due to the nature of the problems I had over the years. So they did a bone graft, which actually took care of the jaw problem, and that worked quite well. However, after 6 months of visitations with that particular doctor, they were still unable to correct the gum problems. I was still getting infections, and they were very, very painful. So just by chance, I saw an advert in the Wesley Chapel Gazette for this technology, the laser technology. So I read into it, looked into it. It looked like another possibility was available to me to correct the problem, which, as I say, I've had for 20 years. So I came in, met Dr. Witt, and scheduled the program, and that was about 6 months ago. The overall surgery took maybe 2 hours, and I felt fine. I mean, I really did feel quite amazed that he had done the amount of work he had done, along with his technicians, to rip the gums apart, clean them out, and put them back together again. And I think the key has been the aftercare program that he had set up with a young lady called Noelle, and she has been the technician that's been looking after my teeth during the reoccurring visits. And during this period, I finished off the last visit about a month ago. The gums are completely healed. There's no pockets in any of the gums. There's no bleeding. I have no pain anymore. So I have actually determined that was money very well spent, and would recommend certainly, if you had the sort of problems I had, for anybody to come back and visit Dr. Witt. He has actually done something that nobody else could do, that I have visited anyway. So during the last few weeks, it's been lovely. No pain, brush your teeth, no blood, floss, no blood, poke around in there, and there's no pockets, and it is quite amazing what he's done. Sure, I'd recommend anybody. Yeah, it's expensive. But when you got a problem like that, it's money well spent. Believe me, I've spent that much plus with trying to get my mouth sorted out.
Tell me a little bit about all of the services that you offer.
A little bit about all of them?
A little bit about everything.
Well, that'll take me forever. A little bit about everything.
Yeah. Or like your favorites, like the favorite services that you guys offer.
Because I offer them, right, they're one of my favorites. Otherwise, I wouldn't do it.
Yeah.
Right? And so being able to offer all the dental services so that you can get your dentistry done at one place is really important to me. You know, I'm one dentist who's providing all of these, right? And eventually my practice will be filled with dentists, several dentists that can provide all of these services. So just going through the list of the services, I mean, first we'll start with healthy teeth and gums, right? So healthy teeth, we want your teeth to be without holes, without infection, right? Without pain. So whatever the tooth needs to cure that problem for you is what the tooth needs. So if it needs a filling, if it needs a crown, if it needs a root canal, if it needs an extraction or removal and a replacement with an implant, that's one. Healthy teeth. Healthy gums.
Okay.
All right, so healthy gums, right, is that we're going to make sure your gums are healthy. If they're not healthy, if your gums bleed or have pain, they're not healthy, right? And we're going to show that to you. Right? We're going to show you when we measure between the gums and the teeth, there can't be any bleeding and it can't be any pain. If it's hurting you when we're measuring between the gums and the teeth, you have infection. We want to take care of that infection, and the way that we handle gum infection is with the laser. We use a periolase, which is a laser specifically designed to treat gum infection, right? And it removes the gum infection from between the gums and the teeth so your body can start to heal. Okay, you're numb while we do the procedure. It takes a couple of hours. We do one side, and then a couple weeks later we do the other side so that we take care of that. And then we put you on a regular cleaning schedule so that we can get you back in, get the gums clean and keep them clean, right? And teach you how to take care of them. Because it's amazing how few people know how to really take care of their gums.
Right.
Okay, so healthy teeth, healthy gums. That's first, right? And then we work on the beauty of your smile. Right, so if the teeth are healthy and the gums are healthy, now we handle beauty. Oh, if we go back to gums, right? Also, you have recession, which is caused by a bad bite. The bad bite causes the recession. Recession, the gums may need to be improved. So we improve the gums with gum grafting, right? So that's taking extra tissue, adding it to the gums so the gums are more fortified so that they're not going to be lost anymore. Because losing your gums around the roots is bad for you because it exposes the roots to bacteria, cavities, holes, and then you end up losing those teeth. And I don't want to see anybody lose teeth. Keeping teeth for life is one of my goals, helping people keep their teeth for life. Let's say you can't keep your teeth for life and we have to get rid of them. Okay, so we offer dentures, we offer implant dentures, right? We offer implant dentures that come in and out of your mouth. So you can take them out, you can brush the implants, you can clean the dentures. A lot of people love those, right? And then we offer the kind of dentures that you can't take out of your mouth.
Oh.
They're screwed into those implants and they're in there, right? They're a little harder for you to take care of, but if you don't want to take things in and out of your mouth, then they're for you. They give you that bite back. You don't have to worry about them. It's like having your teeth and they're not coming in or out, right? So we offer that if you can't keep your teeth. So we cover teeth and gums, teeth, keeping them. If you can't keep them, what we do, and gums, what we do. Great. So now let's talk about beauty.
Yeah.
Okay, so we're going to make your teeth beautiful after they're healthy, right? By making sure you don't have any missing teeth. We're going to replace them with implants. We talked about that already. We're going to put veneers and crowns on them so that they're perfect.
Yeah.
They're perfect in every way, right? Or we're going to align them with braces or Invisalign to get them perfect, right? If they're ugly, we want crowns and veneers on them. If they're worn out, if they're ground down, if they're chipped, that's not something we want to align, right? We want to put crowns and veneers on those teeth to make them perfect, right? If that's what you want. If you just want to align them, That also helps with decreasing the amount of grinding and chipping you're doing, because the reason they're ground and chipped is because they're not aligned correctly. So we can put them in the right alignment. But it doesn't fix how they look, right? Having them look great is part of the confidence that you're going to have to go out in the world and do better. And we want to help with that too, right? So that's why we do beautiful teeth, right, as well as straight teeth. Okay, so if you have pain in your joints, headaches, neck pain, you might have a TMJ problem, right? We put you in a splint to take care of that. Once we have your headaches under control, then we're going to need to move to crowning all your teeth, maybe, or putting you in braces and straightening all your teeth, or you're going to wear that appliance long term to keep the headaches away, right? But if you have ugly, worn, broken teeth, we're going to want to crown all of them, right? And then you don't have to wear that appliance anymore. It's going to put your teeth in the correct position so that you're not getting headaches. The jaw joint's in the correct position because the teeth control the position of the joint, right? Your joint is controlled by where the teeth are. And if they're not in the right position, your joint's not in the right position, your neck's not going to be in the right position, because your head is held on by the spine. The spine is one little point that holds the whole head on, right? And if the jaw's not aligned correctly, it's going to change the position of the head, which changes the position of the neck, puts pressure on the neck, and you have neck pain.
Wow.
So getting the teeth aligned aligns the joint, which puts the head on the neck correctly, which allows the neck to be correct, right?
Yeah.
So we're going to get the teeth aligned, and we're going to get them in the right position. We're going to give you a splint first. If we get rid of the headaches, very effective at handling your headaches, getting you free of headaches. A person free of headaches, right, changes your life completely. Really allows you now to go and have life. Because if you're in pain, you're miserable, you're angry, you're taking it out on your kids and your spouse, right? Or everybody around you or whoever all of the time, or you're in bed all the time, or you're throwing up. Some people have so bad headaches that they're throwing up all the time, all because of the way your teeth are. So we fix the teeth, we fix the headache problem, right? So if you had those problems, you would come to me and I would be able to evaluate if those headaches are neck related or they're teeth related, and we'd be able to offer you a plan to fix that for you, which would lead down to beautiful teeth, because we're going to crown everything probably, right? Get you in a perfect bite and a great smile so that you can go on with your life without any headaches and problems.
Wow. So I can just come to you guys literally for everything.
Everything.
Wow, that's so convenient.
It's convenient, yep. You might have special things that I need to send you out to specialists for, and that's okay. Once in a while we're going to do that. But most things we're going to take care of.
Amazing.
Healthy teeth and gums for life.
I love it.
My name is Bob Beaufort, and I live in Pinellas County. I'm a retiree from the city of Tampa. I worked 25 years for the city as an electronics technician, radio electronics technician for those are the people that mostly service and repair all electronics equipment for police and fire and all city departments. My story started in 1996. I was working at my shop in Ybor City, and the convention center in Tampa at that time hadn't been up very long, and the medical people that were doing our insurance had a health fair at the convention center, and usually those things we had every year, but I never went. I just never bothered, and but it was an extremely hot day, and we were working inside and outside, and one of my friends said, why don't we go down there and, go to the convention center and go to this health fair and see what it's all about, and at least we'll get cooled off. So we went, and I was standing outside of a St. Joseph's Hospital cancer screening, waiting for my friend. He was going somewhere. We were going to go back to work. And the nurse said to me, do you need anything? And I said, no. I said, what's this cancer screening all about? She says, well, normally, it's just for somebody that has a symptom, we'll take a look at you. She says, do you have anything? And she named a bunch of things. And I said, well, I have a little lump in my cheek, but I've had it looked at, and they told me it was nothing. She said, well, why don't you let us take a look? Well, the whole scenario started there. Within an hour, I had 4 doctors on me, right? And they said to me, you got to go see your doctor right now and make an appointment. You got big problems. So I went back to Clearwater, got a hold of my doctor, went and had the following day, had a biopsy taken, sent it up to Shands in Gainesville. 10 days later, they told me I had a rare tumor. So rare that only 10 people ever had that tumor in the world. Only 3 in the United States. So, and malignant. And so I figured at that time, I was done. A very gifted surgeon operated me at Morton Plant Hospital and removed the tumor. And after the surgery was over and I went back to the hospital, the oncologist had told me that if one cell got loose from that tumor and went to my brain, it would have been all over for me, so they suggested I have radiation. So I signed up with Likes Oncology, which is at Morton Plant. It's the Tampa Bay Radiation Society. They're connected between Tampa and Clearwater. And I went through, wound up having a maximum amount of radiation. Probably the most you could get, because at the time, because the tumor was so rare and they knew so very little about it, they decided to throw everything at it. So they literally burned me up. It's like sticking my head in a microwave. Shoot ahead 15 years, right? I was losing a tooth, and I went to a local dentist. And he looked in my file I had, and they said, you can't do nothing with this guy unless you call the hospital. Next thing I know, I was called in for a consultation at the wound center at Morton Plant Hospital, which at the time told me that if the tooth falls out, I could get a disease called radioosteonecrosis, which is a deterioration of the bone. In other words, if the tooth falls out, the socket won't heal, and my skull essentially will fall apart. I went online to check. Most of those people don't last 3 or 4 months. And you can imagine how I felt. So I didn't know what to do. So the people at Morton Plant said they were going to try to put me in a hyperbaric chamber to reoxygenate the bone so they could possibly pull the tooth. The tooth was so loose I could have pulled it out myself. So anyway, in between the time that they did that and I was deciding on what to do, because they had set me up for hyperbaric treatments, which they told me it was only a 25 to 35% chance I'd still get the disease. I seen an ad in the paper. I was reading the newspaper and seen an ad for a dentist in Tampa. You know, it's a long ride. It's like a 30-mile ride over to Tampa. And it had a bunch of pictures in there, laser guy, and I said, well, that's okay. So I called, and I actually talked to Dr. Whitt. He said, well, make an appointment, come on over, let me take a look at you. Dr. Whitt sat me in an examining chair. They took a whole series of x-rays. They did the whole workup on me and said, you know what you got, right? I says, yeah. He says, I'll tell you what. If your doctor didn't tell you, if you start with this disease, you're going to die. And if he didn't tell you, get him on the phone and I'll make him tell you. I says, well, no, I believe you. I says, well, what do I do? He says, well, the only option we have here is to save your teeth. I says, all right, well, you're the doctor. He went ahead and he took that tooth with a laser, welded it, essentially, simply put, welded the tooth to the tooth next to it. 6 months later, the root regenerated. But in the meantime, I had 19 other bad teeth. This is all caused from all this radiation. He essentially rebuilt my entire mouth, right? Today I have, all my teeth are redone. I presently come in every 3 months for cleanings and checkups. Essentially, he saved my life. He really did. I mean, I owe him everything. I can't give him a higher recommendation to anybody. I've talked to dozens of people about Dr. Whitt. He's fantastic, professional, on the ball. You can't beat this guy. Smart, intelligent. I think he's a dental genius. Seriously. And you know, what I didn't say was, 5 years after I got the original tumor, I wound up with bladder cancer, which I'm still being treated for. I'm in remission right now. So I'm a 2-time cancer survivor. I've been through this twice. And all of my work has been done through Baycare, which is a big hospital corporation. They've been terrific. I can't say enough about them. You know, so I've dealt with a lot of medical people over the years. This guy goes to the top of the list. He is absolutely the best. I can't say enough about him, right? If you're in trouble or you got a problem with your teeth, Dr. Whitt is the guy you want to talk to. No question in my mind, right? I've never been happier with, right now, dentistry is not my problem anymore. And it's because of him. And I feel like, even to this day, that I'm taken care of. When I come over here, they look after me. Terrific guy, and he keeps up with all the latest things going on in dentistry. He re-educates himself. This is the kind of guy that dedicated, not some guy that took up dentistry for the money. You know what I'm saying? He did this, you know, he's dedicated to his work. He enjoys what he does. Super guy. Thank you very much.
You know, the big thing about dentistry is we're not all the same. Mm-hmm. One dentist isn't the same as another dentist. And so many people think all dentists are the same. No. We all have a degree and a license to do dentistry. Beyond that, none of us are the same. And you can't go to 2 dentists and get the same treatment plan from 2 different dentists. It's not possible. So people love to go from one dentist to another dentist to another dentist to another dentist, getting opinions to try and find out what they want to do. Now they're completely confused because every dentist gave them a different plan and a different thing. And it's based on their own education, advanced training, and advanced experience. That's it. I've been a dentist for 27 years and I've had a ton of advanced training. So when a person comes to me, I'm giving them a treatment plan based on being able to see all of those things that many other dentists can't see. The crazy thing is that most dentists only do what's required by law in advanced training. And what's required by law is 30 hours, 15 hours a year, 30 hours every 2 years. That's it, which they can do online. They can go to a course somewhere local, and they can have a book club. It's all kinds of things that they can do their 30 hours in and not once get any information on how to do dentistry better. It's all they have to do. The dentists who want to do more, like me, and really take care of people, take a lot of advanced training with in-person, on-people training where you're actually doing the work and getting the training to do the work. And you see things totally different than dentists who aren't doing that, right? I have thousands of hours of advanced training in all of those things that we talked about so that I can deliver this care with confidence and know that I'm going to be able to give people what they want. So you can't compare dentist to dentist. It's so, and it's crazy to think that you can. We're not going to give you the same thing because we don't have the same level of training. So when you come to me, you're coming to me with that amount of training that I have so that I can offer you something that not that many people can, right? So according to the statistics on it, right, the level of training that I have puts me in the top 10% of dentists in the country, training-wise.
Wow.
Right? Only 10% of the dentists have that level of training. There are 200 dentists in Hillsborough County, right?
Yeah.
So only 20 of them have my level of training. 180 of them that you could see have no idea. right? They're just doing dentistry exactly the same way that they learned to do dentistry in dental school and haven't changed a thing. And dentistry is changing every day. Computers advance every few months, right? Computer technology is new, totally new and different. Dentistry is advancing almost as fast. We got to keep up.
How do you treat people who are maybe scared of coming to the dentist or have this fear lingering from childhood? How do you handle that?
You know, that is a really good question, because I do see a lot of people that have dental anxiety, right? I even have dental anxiety. Getting a shot for me, right? Any shot, like in my mouth or in my arm or whatever, I scream and cry and pass out. So I'm very aware of how anxiety affects people. And I make sure that I surround myself with staff who love taking care of people. They love taking care of people. And I love taking care of people, and we're extremely gentle. So in my environment, we like to keep it relaxed. We have televisions that play either TV or music. We're always making sure the TVs are on comedy, or they're the music or that you usually listen to in your car. We want to make you comfortable. So comfort is first. If I can make you comfortable in my environment, you're going to be less likely to have anxiety, right? And then we're really gentle. I want to make sure that nothing hurts you, and that you let me know anytime something hurts you so that we can handle it right away, because I want you to have a really good experience, because I care that you are getting well, right? And if anxiety is a problem, we want to make it gentle for you. So being gentle is the most important thing that curbs the anxiety, and people who have anxiety, that's what they tell me. They tell me, thank you so much for being so gentle. I didn't feel a thing. Now I feel like I can come back and see you again, right? Or that was the best I've ever had at a dentist. Thank you so much. I'm like, oh wow, tell all your friends. And they're like, okay. And I'm like, great. So that's good. But it's about being gentle, and it's about surrounding our guests with people who love taking care of them and just want to have that environment that's calm and reassuring. Sometimes people need more, right? So if they do, we do offer nitrous, okay, which is, you've heard of laughing gas maybe.
I was going to ask, is
right?
it laughing gas?
Laughing gas called nitrous oxide, and it's just some gas that you breathe. It doesn't put you to sleep, but it just calms you down. It's like if you drink alcohol, you're old enough, do you drink alcohol? Yes. Okay, it's like having a couple of glasses of wine. So like, you know, and if you're susceptible to wine, you've noticed that after a couple of glasses, maybe your cheek is numb, and like, you could do dentistry now, because like, cheek is already numb and you don't care.
Yeah.
Right? So it just makes you not care.
Right.
But you're totally awake for it. And also, you know, if you need more, there's Valium that we can prescribe for you so that you have more and you come, you know, out of it, right? But you still not asleep.
Right.
Usually we don't like to do that unless you really need it, but we will for you. But we want to get you to the point where you're comfortable enough that you can be there without it.
Right.
That's the goal.
Is to fix the anxiety around going to the dentist.
Yes.
Right.